My name is Dr. Andrew Tannenbaum. I am a practicing vascular and interventional radiologist as well as a diagnostic radiologist here at Mercyhealth. So as a vascular and interventional radiologist, we have a myriad of things that we can offer in the most minimally invasive way. So we do things that range from image-guided biopsies, where we look inside your body with either CAT scan or ultrasound, and we guide a small needle into a suspicious area and take samples of it. We also do things where if a kidney or a liver is blocked, we can put tubes in to drain them. We can go in and stop bleeding when things shouldn't be bleeding, or we can restore blood flow when there should be blood flow to an area. It's really incredible the tool set we have and the things we're able to accomplish with such small holes. The vast majority of what I do uses a hole that's not much larger than a pinprick, maybe 2 or 3 millimeters. And you can offer life-saving therapies and life-changing therapies with just these tiny little holes that we make. So one area I'm very passionate about is what we call interventional oncology. So patients who have typically liver-dominant metastatic disease or primary liver disease, or patients who have kidney cancer, we can offer them a range of advanced therapies that are non-surgical. So the choices we have available to us range from we call thermal ablation, where we put either a needle that heats up quite a bit or a needle that gets very cold, and we can either freeze or burn certain tumors to death. We can go in through the blood supply to the tumor, and we can provide chemotherapy while simultaneously blocking off the blood supply to the tumor, and sometimes we even combine that with a thermal therapy. So we offer something called radioembolization with a material called yttrium-90 or Y90. They're little glass beads that have this high-energy radioactive material embedded into them. And we can go in there and instill those beads into the liver, and those provide ongoing internal radiation treatment to these tumors for weeks afterwards. It's really a spectacular treatment where patients can not only improve their overall survival, they can improve their progression-free survival, but to me, most importantly, their quality of life doesn't go down as a result of it. And the best part about this is you can still continue chemotherapy alongside with it, so really hit it in both directions. So one question patients ask me frequently is, how do we choose the right therapy? Typically, each therapy is going to be individualized to each patient and each cancer. Not every patient's a candidate for minimally invasive therapy, but for the ones who are, we can sit down and have a conversation about how we want to approach it. So we talk in the office, we'll go over the imaging findings and discuss treatment options, and then we talk in a multidisciplinary tumor board. So we work very closely with the medical oncologist, with the surgeon if there's one involved, with the radiation oncologist, and we all come to a consensus that yes, this is the best treatment for this patient for this cancer. So a typical treatment day for one of these therapies, whether it's going to be thermal ablation, whether it's going to be embolization, patients come in first thing in the morning typically, and then if we're going to do general anesthesia, we'll have them meet the anesthesiologist and get set up for that. And then we'll bring them back to the procedure area, whether it's in CAT scan, whether it's in our angio suite, and we'll either put them to sleep or give them some sedation, and then we'll offer the treatment. Typical treatment takes a couple of hours. Most patients will go home the same day with a Band-Aid. Occasionally we'll spend a night just to be extra safe. So I first came to Mercyhealth as we call a locum, as a traveling physician. Had some time off and I'd come up here and do some shifts. And the first thing I noticed is when you pull into the parking lot. I'm used to these old dingy city hospitals. You get this dilapidated building, you walk in the front entrance, it's dark, it's dreary. You pull up in the parking lot here, you have this beautiful, gleaming glass and stone building. You walk in, it's bright, it's air-filled, and you know you're in a state-of-the-art facility. And then when I got upstairs to my lab, I was blown away. So we have this integrated, we call it CVI, so cardiovascular intervention platform. We have 5 rooms in a row, we have a hybrid operating room, and what really struck me is this was the same equipment I was using in my training at one of the top 5 hospitals in the country. And in fact, this was the newer equipment. I knew I was off to a good start. So I started picking out a few shifts here and there, and the more time I spent here, the more I wanted to be here. And ultimately, I was able to secure a full-time position at this phenomenal facility. And what I learned over time is, one, we have state-of-the-art equipment, a phenomenal support staff, and then the other services here are what really allow us to offer the most advanced therapies. So it's not just being able to do the procedure, it's being able to manage the patients before and after. So we have a phenomenal intensive care unit, phenomenal surgical service, phenomenal GI service, to name just a few. And having that infrastructure and that support really enables you to do the advanced procedures, to take care of patients, because you know that they can be managed in the long term. So to me, coming here was almost like coming back to a university, where we have these state-of-the-art facilities, we have these high acuity patients, and we have the ability to take care of them right in their community.